CareShare, I'm very appreciative of this opportunity. CareShare is really committed to changing the face of senior care, family communication, and engagement based on my own family's experience. 10 years ago, my mom entered the long-term and post-acute care ecosystem because of her failing health and early onset dementia. Long-term is senior living and assisted living. Post-acute care are typically nursing homes, and she was in all of those. The problem really arose when my family, who lives all over the United States, realized that it was not going to be possible to receive any kind of current updated information about my mom's situation. And my family only received bad news. She had fallen, she had a urinary tract infection, one time she had a cut on her arm. And so my family grew much more troubled and disheartened over this whole situation. But because I had 3 decades of customer relationship management experience, I saw this as a relationship and communication issue that a good CRM solution could provide. So I decided to go look into the market and see what the problems were. I talked to families first. Universally, every family member said, yes, we want more communication, and yes, we want more opportunity to stay engaged. In fact, we're willing to pay for that. The facilities I talked to had the same issues recurring over and over. They didn't have the resources to be able to collect all of this information and get it sent to family members. They all used electronic medical record systems, but those are 20-year-old technology, and they're just not capable of delivering family communication. By law, they're forced to communicate this bad news, these falls and urinary tract infections. And when you feed a family a spoonful of bad news over and over again, they get very bitter about your organization. And then when you combine that with the fact that these organizations have very limited transparency, it increases legal risk. In 2018, there were $5.3 billion in legal losses in this industry, growing at 6% a year. So clearly there was a demonstrated need. We needed to be able to provide the ability to summarize information and send good news, not just bad news, about a resident to their families, provide their families a variety of engagement options, and do all of that without burdening the staff. We were very fortunate early on to sign up a paid beta partner. In fact, they're still our paid beta partner. And they were able to share with us, beyond just the communication issue, other challenges that they were facing in this business. And we were able to build solutions for them that really made CareShare much more powerful. When we rolled the system out, we realized quickly that this was going to benefit everybody. Now, what you're seeing on the screen now is an analytical dashboard. We have many of these analytical dashboards in CareShare. This one happens to be focused around activities. But the point is that these communities now can analyze data they never had access to before, and they can expand their choices for their residents. They can market the fact that they communicate with families, and then they keep families engaged, and that gives them a distinct marketing advantage in their market. And you combine that with this expanded transparency, and it has the ultimate effect of reducing their risk. Families are benefiting because, number one, they're getting this same dashboard information, but reduced to just their family member. And they are not just getting pushed information, but they have the ability to communicate 2 ways, not only with their family member, but with the staff at the facility. And residents benefit because they know they can communicate with their families. There's not these long distances that prevent communication. And it really serves to improve their quality of life. All of us understand that the baby boomer population is exploding in growth. The numbers are really astonishing. 10,000 baby boomers a day are turning 75 years old. That started in January of this year, and it will go for another 2 decades. If you agree that the experts say that more than half of that population will need some kind of long-term care in their lifetime, the current population of 2.7 million beds in inventory will not be sufficient to support the organic growth of this marketplace. But we wanted to take a conservative approach in calculating our SOM. So we took the current inventory of beds, we carved out assisted living and skilled nursing facilities, and then we just took that matched our target, and then we just took a look at assisted living facilities, came up with a SOM of 116,000 beds, which will produce about $27 million a year in recurring revenue. Our business model is very straightforward. We charge a one-time implementation fee. That's for implementation, training, and support. We then charge a subscription fee of $20 per bed per month. We use a one-year contract with an evergreen renewal clause that aligns with our contract with Salesforce.com, on whose platform we built CareShare. With that contract, we have our custom code in CareShare protected by Salesforce. So no one can take that and disassemble it and figure out our tricks and go into market against us. We expect about a 2% churn, because that churn number is the churn number that electronic medical records providers have experienced in this market, and they've been in this market for 20 years. So we expect after churn that we'll have average recurring revenue of about $236 per bed per year. I'm lucky to have a great team. I have more than 3 decades of CRM consulting experience myself. I worked with IBM in their healthcare CRM group for 10 years, and for 10 years I've worked with Salesforce. I have 2 exits, one in the CRM world and one in the cellular telephone rental world, where we were purchased by Motorola. Rav Reedy is a certified Salesforce architect and the original CareShare developer, and he knows more about the system than any of us. Ken Mickish is our growth and exit strategy guy, because he has been through several exits. He was at Jar Dogs when Allscripts purchased them. He went to work for Allscripts, and he worked in the acquisition of several different organizations into Allscripts. Our advisory board is growing very much. Greg Chamberry and Bev Rowe are the oldest members of that group. Greg is the outgoing chairman of the New York State Health Facilities Association, and he is also the owner of the Maplewood, who is our paid beta. Bev is a senior Medicaid auditor for the state of Nevada and audits skilled nursing facilities, and is very aware of the regulations and challenges faced by this industry. There are a growing number of businesses competing in this space, and they're offering a whole variety of solutions and capabilities, but that really is signaling that there is demand to be captured. With these 4 competitors, who are considered the largest, they are only under contract for less than 100,000 beds in a 2.7 million bed market, so there's plenty of business here. We're going to drive our growth in several ways. This COVID-19 virus has really shined a light on what I consider a critical social issue in elder care facilities, and that's the inability to communicate. When you have families who can't get into a facility and residents who can't get out, the demand for communication accelerates. We think that facilities who may have considered family communication to be either a luxury or a burden will now see it as a requirement. We're going to go after assisted living facilities, 60+ beds. We're going to leverage our Point-Click Care partnership. Point-Click Care is the largest provider of electronic medical record systems in the world. They have 20,000 clients and have about 1.3 million beds under contract. We want to grow our skilled nursing facility sales partnerships. There are several good players in that market already who are looking to expand their product mix. And then we also want to explore other care organizations, because it's largely underserved. We've had great traction. We built the system and managed to get a paid beta early on. We signed our Salesforce agreements, and that same year had 3 major functional releases. Last year, we signed our Point-Click Care partnership and signed 2 contracts and received our initial seed investment. We really want to achieve our assisted living facility SOM, because our exit strategy is to be acquired by 2025. We're asking for $400,000. That gives us a 14-month runway to cash flow break even. We have received $50,000 from our lead investor. I've funded $250,000, and the majority of that money will go toward marketing, sales, and customer support. I think had we had 10 years ago a choice between a facility that offered communication, one that didn't, we certainly would have made that decision earlier. I'm Chip Rowe, and I'm with CareShare Manager. Glad to answer any questions you might have.